Hello friends, welcome to Forensic Medicine by Dr. Paras, and now we are going to talk about the chapter 9, that is virginity. What is impotency, pregnancy, what are the laws associated with the pregnancy? So first topic what we are going to discuss right now is impotency. What do you mean by impotency? Sir, inability of a person to achieve and maintain the penile erection is called as impotency. So basically, impotency is what is trying to say in the simple words. You're not able to penetrate. You're not able to penetrate the penis. Anyway, if you're not able to penetrate the penis, how the person will marry you? How the child will be produced? So that is why the basic term given is impotency. Sir, there are two types of impotencies. The two most common causes of impotency. One is psychological cause. You will see, when you are under heavy stress, when there is lot of stress in your brain, you're not able to focus. If you're not able to focus, your sexual pleasure, libido, etc. will go down. So you are so much into pressure. For example, there is an exam stress, or there is some kind of tension going on, medical tension going on. In that scenarios, you will see your head is completely engaged somewhere else and you are not focusing onto the one place. If your focus is lost on the one place, then also the person is not able to achieve or maintain the penile erection. This is psychological cause. Now vasculogenic. How vasculogenic? Guys, remember, penis erection happens when blood flow increase. If penis is getting lot of blood, then there will be an erection, my dear friends. If blood supply is less, the penis will not be erect. Moment you have seen the exercise squeeze technique, whenever there is a pre-cum ejaculation thing is going on, in that we give treatment as a squeezing technique. What we do in squeezing technique, for example, this is penis. So we squeeze that penis. We squeeze the penis, and after squeezing, what will happen? The blood supply to the penis is decreased. The moment the blood supply to the penis is decreased, it will settle down. It will settle down. So this is what the difference is between the psychological and the vasculogenic causes. So most common, if someone will ask you which one is the most common cause of the impotency, your answer would change into psychological, more common than the vasculogenic cause, my dear friends. This is for the impotency. Now coming to the quad, my dear friends. Quad is impotency towards the particular woman. What is quad, my dear friends? Quad is impotency towards the particular woman. Particular woman impotency is there. So this person is having sex with all other women, but when it comes to own wife, he fails to achieve erection. So the cause here is psychological. Psychological cause. Maybe that person didn't find that female very attractive like that. Any cause can be there, my dear friends. So remember, so this is all about the quad, impotency towards a particular woman, and never necessary that woman is a wife only. It can be any woman in the society which can be there. Coming to the next thing is frigidity. The third terms what we are going to discuss is, sir, frigidity. Frigidity means sexual coldness. Means husband is complaining, husband complains that after lots of efforts, female is not turning on. The female is not turning on. There is no pleasure she is getting. in having sex. That means this is called as female impotency. Female impotency is, if penile erection is there, we call that as simple impotency. If female is not getting the sexual desire inside her, she is cold, not at all a single hormone rush is there, then we call that as what's her frigidity. Sexual coldness is called as what's her frigidity. Done. So sterility. What is sterility, my dear friends? If it is sterility, sterility is inability to produce the children, and this can be seen in both male and female. In the earlier time, it was believed, this was like in wrong message in the society, that for the sterility only and only females are responsible, and for a child also only female and female responsible, but it is not, because female carries only X chromosome, but males carry XY chromosome. If X goes here, then there will be a female child. If Y goes there, then there will be a male child. My dear friends. So inability to produce children can be seen in both female, and they both can be equally responsible. There are some female factors, there are some male factors. If I tell you about the female factors, some of the female factors: anovulation can happen, then cervical incompetency, can be there. So these are the some reasons because of which female become sterile. She is unable to produce the children. Male factor, if I talk about, in the male factor, we should be remembering about the impotency, then oligospermia, hormonal disbalance, many causes are there. We just have interpreted the few of the causes in the female and the male, my dear friends. Now, what do you do for the male factors? Like there is a artificial reproductive techniques, ARTs, artificial insemination techniques are there. In artificial insemination techniques, what we do, sir, artificial introduction of semen. Semen is real, but the method is artificial. The method is artificial into the female genital tract. That is artificial insemination. So what we do, for example, artificial insemination is done for what? When there is a hypospadias. That means now your urethral opening is not at the glans penis, it is somewhere else. It should be ideally here, but it is now here, anywhere here, hypospadias. Then you are ejaculated, and the ejaculation is not directly going into the uterus. For that purpose, one of the reasons can be hypospadias. Then impotency, because the penis erection is not that hard that the penis is able to penetrate the vagina. If not penetration of vagina, then ejaculation will not happen in the vagina and it will not go inside the uterus, my dear friends. So these are some reasons for the artificial insemination. Other reasons can be retrograde ejaculation. Retrograde ejaculation means you are ejaculating in the front and it is going in the back. This is called as retrograde ejaculation. Other causes can also be there. We'll be writing down very soon. Now, artificial insemination, hypospadias, impotency and retrograde ejaculation, my dear friends. Other than that, semen. We have to take semen now. Semen can be taken from whom, my dear friends? If you talk about semen can be taken from the husband. Other causes we were writing, it is oligospermia. Less sperm is there, less sperm count is there. So you need to get the sperm, and also one more reason is there, anti-sperm antibodies. Anti-sperm antibody. Anti-sperm antibodies, they are present on cervix. They are present on cervix. Moment the sperm is entering from the cervix, they are damaging the cervix. They are damaging the cervix. The cervix is getting damaged because of the anti-sperm. So these are the reasons for the artificial insemination. Some reasons for the artificial insemination. How is done? Semen is taken from whom? Number one is husband. Second is can be a donor. And donor name, identity, etc. we should not disclose, my dear friends. There are requisition for the donors. We'll be learning that also shortly. He should be healthy, no disease should be there, and some standard protocol and the guidelines are followed while selecting the donor. But the patient and the donor, they are kept blind between themselves. They will never know who was the donor, and donor will never know who was the patient, my dear friends. That middle people, they are the medical fraternity who has to take care about these things. Then pooled. Pooled means some from the husband, some from the donor. Some you are taking from the husband and some you are taking from the donor. So with three ways from three people, or you can say you can take the semen. One is husband purely. Second is donor, because husband is aspermia, suffering from aspermia, or azoospermia is suffering from. That is the reason we have to choose the donor. And oligospermia is there. Then we can take some of the product from the husband, some from the donor, we combine and then we do the artificial insemination, where the device is taken and it is directly penetrated inside the uterus, my dear friends. Now what are the general requirements in this? What are the general requirements in this, my dear friends? Consent from both husband and wife is needed, because their children is going to come in the society. That is why consent is needed in the both. But if I talk about the medical termination of pregnancy, my dear friends, in the medical termination of the pregnancy, consent is not required from both. But here, when there is artificial reproductive techniques we followed, we take the consent from both of them. That means husband and wife both. Identity should not be disclosed of donor. That is vice versa. That means donor to recipient and recipient to donor, both. They both should be blind. They both should not know whom they have given the sperm and whom have received the sperm, my dear friends. Then same doctor should not conduct a delivery. Yes, the main point. The doctor who was taking the sperm, who was doing the artificial insemination, he is not allowed to conduct the delivery. For the delivery, you have to choose different doctor. This is rule. Same doctor should not conduct the delivery. For the artificial insemination, different doctor should be there, and for the conduction of the delivery, there should be a different doctors. So three general requirements which are there. Consent we need from both husband and wife. Identity should not be disclosed. Same doctor should not conduct the delivery. Now coming to the prerequisites for the donor selection. Donor age. The age should be young, healthy age. That is why less than 40 years. Otherwise you will not take. More than 40 years, donor is not eligible to give the sperm. Then must have children. The person who is donating the sperm, semen, he must have children. Age less than 40 years, plus he must have children. That is a basic requirement. Plus he should be from the same race. Like, what are the type of races we are having, sir? The type of races from 70 to 75, 75 to 80, 80 to 85. This is cephalic index. According to cephalic index, we are having races. First is dolichocephalic. Dolichocephalic. Dolichocephalic is seen in Negroes, Aryans. So dolichocephalic, same race is required. Other race is what, sir? Mesed cephalic. Mesed cephalic is seen in Indian and Chinese. Then the third one is brachycephalic. Brachycephalic is seen in Mongols. Means if the recipient is Negro, then the donor should also be Negro. If the recipient is Indian, the donor should also be Indian. Caste etc. is not mandatory right here, sir. Here mandation is of a race, and different type of race we have seen just here, sir. These are the different type of races we have seen. Now coming, if possible, the word if is there, if possible, same blood group, so that RH incompatibility should not be there. Same blood group we try to see, same blood group, okay. Donor should not have any disease. To check the donor should not have any disease, there will be a complete body checkup. Complete body checkup is done. In this, CBC, renal function test, LFT, hepatitis B, C, HIV, VDRL marker for syphilis. All those things are done before. Other tests are also there. This will tell that donor is healthy or not. So what are the 5 things you need to check right here, sir, for the donor? Age should be less than 40. He should be married and have children, okay. Same race is required. If possible, same blood group is required, and donor should not have any disease. For that we do the test etc., my dear friends. Now coming to the next topic, and next topic is all about the virginity, my dear friends. If we talk about the virginity, the person who have not experienced sexual intercourse is called as virginity. Is called as what, sir? Virgin person. Then another is defloration. The term called as defloration. The person who lost virginity is called as defloration. Losing of virginity, or you can say losing of virginity, not the person, we can correctly write it, losing of virginity is called as defloration. Is called as what, sir? Defloration. Now what are the signs of virginity? Signs of virginity is intact hymen. The hymen should be intact, and narrow and tight vagina. Other thing is also there. That is called as what, sir? False virgin. False. What is false virgin? The person experienced sexual intercourse after sexual intercourse, vagina is intact. There can be different reasons for this. One reason can be like this: hyperplastic vagina, hymen. Second is penile length was short. So these can be the 2 reasons. They had sex, they had everything, but still the hymen is intact. So this type of virginity is called as false virginity, false virgin. True virgin means that hymen is now ruptured. And sign of virginity is what, sir? The person who has never experienced sexual intercourse, that is intact hymen, narrow and tight vagina. Two important signs, intact hymen and narrow and tight vagina. Now types of hymen if we talk about, sir. First of all, you will see imperforate hymen. This is hymen, my dear friends. This one is clitoris. Imperforate hymen. It's not perforated. This means virgin. Virgin. This vagina is for virgin. Now other than that, we are having annular hymen. You will see the hole right here. This is anterior side, this is posterior side. Mostly on the posterior side, we can say like this: 2/3 anterior, 1/3 posterior. So annular type, annular hymen is a ring-like hymen is there. Ring-like rupture is there, ring-like. Then septate hymen, you will see it is divided into two parts. Two holes are there right here. So two holes are there. There is a septum. If I can show you right here, sir. There is a septum you can observe right here. There is a septum right here, sir. You can observe septum which is dividing two. So this is septate hymen. Other type of hymen is cribriform hymen. Cribriform, the sieve-like hymen. Cribriform hymen. Sieve-like hymen is there. Cribriform hymen. Then there will be a paros intorius hymen. Completely hymen is ruptured. Complete rupture of the hymen is there. So these are the important 5 types of hymens we see here. Number 1 is imperforate. The hymen is intact. Now annular type, ring shape hole is there. Septate is dividing to cribriform, sieve-like holes are there. And if perfectly it is perforated, that is paros intorius hymen. Paros intorius hymen. Now sir, if we talk about something, important cause for the hymen rupture. What are the important causes for the hymen rupture? So what are the hymen rupture causes? First of all, sexual intercourse, obviously. Because of the sexual intercourse, the penis is going inside, penis will penetrate the hymen and it will land inside. Sexual intercourse is the first thing. Second thing is masturbation. If you are doing the masturbation, and sir, if there is a sexual intercourse, the side from which the site from which the hymen got ruptured, site of hymen rupture, the site of hymen rupture would be posterior. And if masturbation is there, the site of hymen rupture, the site of hymen rupture would be anterior. Anterior. Third cause might be the trauma. Third cause might be the trauma. And the fourth cause is surgery. There might be some kind of chromosomal abnormalities because of which we have to do the surgery, and while doing the surgery, for example vaginoplasty etc., we have just cutted the hymen. Fifth cause is solapith. Solapith is a plant, my dear friends. Why solapith is used? Where it is used? From where it is coming? Solapith is used for female child. Where the solapith is used, my dear friend? It is used for female child to, for what? For what? For what? For what? For what? To increase the vaginal size. Because many places, early childhood sex, early marriages are happening in those places. There's very common that they will try these kind of bullshits to increase the vaginal size, and in that scenario only there is a high chances there must be a hymen rupture. Other thing is, yes, solapith is done. Then sanitary, yes, sanitary tampons. Over insertion of the sanitary tampons can also lead to the rupture of the hymen. It can also lead towards a rupture of the hymen. Rupture of the hymen. Rupture of the hymen. If it is site of hymen rupture, as I already told you, it is due to penile penetration, then it is posterior lateral site, my dear friend, posterior lateral site. And if it is due to the masturbation, then the site would be the anterior side. Because of the masturbation, the site would be the anterior side. Because of the masturbation, site is anterior side, my dear friends. Now let's talk about the pregnancy, my dear friends. Let's talk about the very important topic called as what, sir? Pregnancy. So pregnancy, if we see right here, sir, pregnancy, surest sign of pregnancies we are going to talk about, because pregnancy in detail will be discussed in the obs and gynae, but here we will talk about only the significance. That means we need to check baby is viable or not. The surest sign of pregnancy, fetal parts are palpable. If you palpate the uterus and if you see the fetal parts, that means the pregnancy is viable. Pregnancy is viable. Okay. Now, palpation of the fetal parts. Palpation of the fetal parts. Head is there. Where is the back? This, if the baby is growing, earlier you palpate, you observe that there is less mass, then mass is increasing, that means baby is viable. And if still mass is there, that means baby is dead. That is different topic. So palpation of fetal parts, then palpation of fetal movements. This palpation of fetal movement is also called as quickening. 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 If the female is multiparous, then quickening is seen at 16 weeks onwards. If it is primipara, then quickening is seen at 18 weeks. The mother will be telling you that, Dr. Saab, my baby is kicking, my baby is rolling, playing. That kind of movement is called fetal movement. Palpation of fetal movement, fetal movement, fetal movement. It's called as quickening. Auscultation of the fetal heart sound. Auscultation of the fetal heart sound with the help of stethoscope is the best clinical sign. Best clinical sign of pregnancy. Best clinical sign of pregnancy, and this is seen 18 week onwards. 18 week onwards. 18 week onwards. 18 week onwards. But cardiac activity on ultrasound, it is possible to see 5 weeks onwards. The transvaginal and transabdominal you are going to see in the 6 week onwards. We'll see X-ray finding. X-ray finding you can take. Ultrasound finding. Ultrasounds are of two types, transvaginal and transabdominal. Transvaginal scan and transabdominal scan. If we talk about the heart, 5 weeks, 6 weeks. Transvaginal is little earlier as compared to the transabdominal, my dear friends. So these are the signs how to check the pregnancy. Palpation of fetal part, palpation of fetal movement, auscultation of fetal heart sound, X-ray, ultrasound finding, etc. We can choose here, sir. Done. Now important terms, guys. Spurious or phantom pregnancy. Spurious or phantom pregnancy. Spurious or phantom pregnancy is a term. We see what this is. Spurious or phantom pregnancy, if we talk about, the female is pretending the pseudo pregnancy. The female pretending that she is pregnant for the secondary gain. What is this secondary gain? Secondary gain is money. You went somewhere, you had a relationship with someone, and that someone is not now with you. You had a long distance relationship. After 2 to 3 months, that someone is calling you and telling you she is pregnant, send the money. You are asking for the proof, she is not giving, but she is continuously threatening, if you will not send the money, I am pregnant, you will go to jail, etc. for the secondary gain. And this condition is because of the psychological disturbance also. Intentionally also you can do this, and psychological disturbance is more common than the intentional. Psychological disturbance is most common than the intentional one. So this is spurious or phantom pregnancy. For what it is done? It is done for the secondary gain. What is secondary gain? That is money. The female is continuously threatening you. If you will not give the money, she will send you jail, my dear friends. So this is spurious or phantom pregnancy. Now we coming to the next topic is supposititious child. Supposititious child. Sir, supposititious child is also called as fictitious child. The child produced by a woman who claims it as her own, but it is not her child. You see some people walking on the road, they are carrying the child. They are carrying the child. But the child is not her. The child is someone else's child she is carrying with her and claiming that is her child. How to check? DNA, etc. Obviously. Face appearance primarily will check that it is matching or not, will take history, etc. Then the definitive we can clear it with the help of DNA, my dear friends. So supposititious child or fictitious child, the child produced by a woman who claims it as her own, but it is not her child. She might be stealing someone's child. She might be doing some kind of business, the beggar business. Mostly in India, it is very common, beggar business. They are taking the child and they are making them go for begging, collecting lot of childs, claiming that that is their child. So these are the problems which people are facing, this supposititious child, fictitious child. Now coming to the next thing is legitimate child. So legitimate child. Under section 112 Indian Evidence Act, child born during the legal marriage is called as legitimate child. This legitimate child would be like he can claim or she can claim the parental rights. Anything which is related to the parents can be claimed to the child. This is legitimate child, child born during the legal marriage. The child is legal child. Posthumous child. What do you mean by posthumous child? Sir, the child born after the death of a father. If a child is born after the death of the father is died and after that child is born, then we consider that child as posthumous child, my dear friends. Posthumous child. Another term we need to see here is atavism. Atavism. Atavism, the child resembles the grandparents. Law of inheritance. Law of inheritance. Grandparents, they'll resemble their children than their children. We can easily identify that this is a child belonging to those person or that person, that family, by the hairs, by the appearance, by the eyes, by everything. You understand? So atavism is a law of inheritance. That is nothing but child resemble the grandparents. Now my dear friends, superfecundation. Superfecundation. If we talk about the superfecundation, fertilization of two ova in the same ovulatory cycle by two separate acts of coitus by same male or different male. For example, this ova attacked by one male differently, or this ova attacked by different males, my dear friends. So this is very rare condition. Fertilization of two ova in the same ovulatory cycle, then by the two separate act of coitus, and most commonly it is by the different males. The success rate of different male is more than the same male, my dear friends. Now coming to one more term we are having right here, sir, superfetation. Another term what we are having, sir, superfetation. Before that, I just want to tell you about one more definition right here, sir. You have to write, that is affiliation case. Affiliation case. Affiliation case, my dear friends. Female claiming particular man as a father of her child. Affiliation case can be filed if a female is saying that I slept with you, because of you my baby is there, now you have to take responsibility of the baby because we both are responsible for this, so you have to take the parental right. You have to accept that you are the father. If he denied, she can file the affiliation. This is affiliation case, my dear friends. Superfetation, fertilization of two ova in the different ovulatory cycle, but two separate act of coitus, two different ovulation. This is the rarest of rarest condition can happen. Superfecundation is same ovulatory cycle, superfetation is different ovulatory cycle, my dear friends. Now after pregnancy we will be talking about the next topic called as what, sir? Abortion. A very important topic called as abortion. Spontaneous or induced expulsion of product of conception before the viability. So age of viability in India, age of viability is 28 weeks. Some books say 24 also, but we take 28 weeks only. Abortion is of two types, one is legal, one is illegal. Legal abortion can be with consent of mother, plus legal abortion must follow guidelines of Medical Termination of Pregnancy Act 2021. So this is legal. Illegal abortion without consent of mother. Without consent of mother, if you are performing abortion, we consider that as illegal abortion, my dear friends. Now, MTP Act 1971 versus MTP Act 2021. What are the differences, my dear friends? We have to read right here. So, according to MTP Act 1971, less than 12 weeks, if we say, sir, one doctor is required. Less than 12 weeks, how many doctors are required? 1 week. But according to the new rule, 0 to 20 weeks, one doctor is required. According to MTP Act 1971, 13 to 20 weeks, 2 doctors are required. But now, according to new act, my dear friends, 21 to 24 weeks, 2 doctors are required. So this is a latest rule which we are following, in which it is said 0 to 20 weeks, 1 doctor is required. 21 to 24 weeks, 2 doctors are required, my dear friends. Now, another thing comes, more than 20 weeks, only done in emergency, according to the last, that is MTP Act 1971. But fresh rule says what? After 24 weeks, the abortion can be done. Only up to 24 weeks, normally it can be done. Only done in case of fetal abnormalities with the review from the medical board. If there are any kind of fetal chromosomal defect, etc. are there, then with the review of medical board, the case file is given. Case file is sent to medical board and they will give the permission. Give the permission. What if contraceptive failure is there? Write down here only. If contraceptive failure is reason, then abortion is only, then MTP allowed only till 20 weeks. Then only 20 weeks, otherwise till 24 weeks we can go with, and beyond 24 weeks only allowed if there is any kind of fetal abnormalities or if there is any kind of threat to the mother's life. In those scenarios only we can go beyond 24 weeks, my dear friends. Now, indication of MTPs. What are the indication of MTP? Number one is therapeutic. Risk of physical or mental injury to the mother. Any kind of mental injury or the physical injury to the mother, if there is any threat like that, and that scenario we can consider the medical termination of pregnancy, that is totally legal. So first reason is therapeutic. First reason would be what, sir? Therapeutic reason would be there. Second reason would be eugenic. Exposure to X-ray or teratogenic drug will lead to what? Malformation of baby. and that can be detected in very first trimester. The first test can be done in first trimester, and beyond 24 weeks also we can go for the medical termination of the pregnancy if there is any kind of malformation of the baby, any kind of chromosomal abnormalities, any kind of teratogenic, means malformation of the baby because of the x-rays or any kind of drugs which are teratogenic drugs. Mother has mistakenly taken that drugs, and because of those drugs the baby is now malformed. Third type would be the humanitarian. Humanitarian is a rape. If the female was raped, there is no time limit for the abortion. With the review, again with the review of medical board, we can opt medical termination of pregnancy. No age limit is there. We can go beyond, yes, beyond 24 weeks also it is allowed. It is allowed. Fourth is socioeconomics, that is failure of contraception. If someone is giving you reason that there was failure of contraception, then only till 20 weeks. Only till 20 weeks medical termination of pregnancy is allowed legally. Medical termination of pregnancy is allowed legally. Now, eligibility criteria of conducting MTP. Now, first with this only I'll add one topic called as emergency contraceptives. What are the emergency contraceptives? Then we'll come to the eligibility criteria for conducting the MTP. So what is the emergency criteria we're having for the abortion? So emergency contraception. Emergency. The topic is emergency. Emergency contraception. So first of all, we are dividing into three categories. What three categories we are having, sir? First is less than 72 hours of the unprotected sexual course. Then we can use the medicine. First, combined OCPs, oral contraceptive pills. Second, we can use this mifepristone. Third, we can use this levonorgestrel, LNG, levonorgestrel. Then second criteria is up to 5 days. Up to 5 days. Sir, up to 5 days, we can use a drug called as ulipristal. 30 mg it is coming, ulipristal. Then fourth, up to 5 to 10 days. 5 to 10 days, if we talk about 5 to 10 days, then we can use IUCD, copper T. IUCD, copper T we can use. So this is emergency contraceptive we can use. And now we talk about something called as eligibility criteria of conducting the medical termination of the pregnancy. If we see right here, sir, eligibility criteria of conducting the MTP, we see we need a diploma or degree in OBG. We need what, sir? Diploma or degree in the OBG. First thing is required, plus 1 year experience in the OBG department. 1 year experience is mandatory in which department, sir? OBG department, and at least assisted 25 cases of MTP. So three important criteria: diploma, degree in OBG, 1 year experience in the OBG department, at least assisted 25 cases of the medical termination of the pregnancy. Then you are eligible to conduct the delivery alone, my dear friends. Now consent, if we talk about, is obtained in form E. The consent is obtained in form E, my dear friends. The minimum age for getting consent is 18 years, as we discussed before also.
For the consent giving, for the major surgical procedure, the consent giving age is 18 years. But if there is a physical examination, the consent giving age is only 12 years, my dear friends. Now, husband consent is needed or not needed? Not needed. But for the artificial insemination, my dear friends, the husband consent was needed. Both husband and wife consent was needed. But here in the medical termination of the pregnancy, husband consent is not at all needed, my dear friends. Only mother can give. Or if mother is insane, if mother is insane, who can give the consent? If mother is insane, who can give the consent, Maje? Insane mother consent is given by legal guardian. Legal guardian means parents, own parents, my dear friends. Own parents can give the consent. Now coming to the next is criminal abortion, my dear friends. When we consider this abortion as crime, induce expulsion of the fetus from the mother womb unlawfully and when there is no therapeutic indication. Whatever indications, there was no rape, no chromosomal abnormalities, no threat to mother's life, nothing was there, and still you opted for the abortion, that is considered as the criminal abortion. So method of criminal abortion can be the mechanical, can be abortifacient age drugs, abortifying drugs you can say, or can be the instrument, my friends, can be used as instruments also. So abortificants, drugs like embolics. Embolic drugs are there. They act directly on the uterus. How they act? They act directly on the uterus and they increase the uterine contraction, which result in the expulsion of products, and that will lead to abortion. The embolic drugs, for example, ergot, quinine, lead, strychnine. Strychnine mimics which toxicity, sir? It mimics the tetanus. My dear friends. So abortifying drugs like embolics, remember, they act directly on the uterus. Where they act? The site of action at the uterus, they increase uterine contraction, which result in the abortion. Examples: ergot, embolic, ergot, quinine, lead, strychnine. Strychnine mimics the tetanus. Done. Now, agoguis. Product increase menstrual blood flow. Agoguis is example. Remember, it act only when given in large dose. They can only act when given in large dose. Imamin, agogus, the same different names we call them with. These products will increase the menstrual blood flow. They act only when given in large doses. For example, 7, borax, prostaglandin, estrogen. 7, borax, prostaglandin and estrogen. 7, borax, prostaglandin, estrogen. So these are the examples for the drugs. Now instrumental, medical we have learned. Now instrumental, those causing rupture of the membrane. What will happen after the rupture of membrane? There will be prostaglandin. What prostaglandin will do? They will increase the contraction. Contraction will be there, then abortion will happen. Rupture the membrane. Abortion stick is there, which is also increasing the prostaglandin. Again same contraction will. Syringing. There is a syringe is Hagginson's syringe. Hagginson's syringe also. Prostaglandins are released, then there will be contraction, then baby will come outside. Now, cause of death in the criminal abortion. What are the different causes of death in the criminal abortion, my dear friends? If you see here, immediate cause. Immediate cause can be the fat embolism, air embolism. Immediate cause can be fat embolism. Air embolism is earlier than the fat embolism. Fat embolism will take at least 2 to 3 days. Air embolism you can see within
12 to 24 hours.
Vagal shock can be there, my dear friends. Because of abortion, there can be a vagal shock. Plus, there will be a lot of hemorrhage. The person can die because of the hemorrhagic shock. Hypovolemia, hemorrhagic shock. Hemorrhagic shock. Shock. Perforation can be there. There can be a perforation of uterus. And patient will die of shock. Patient will die. These are some immediate causes: fat embolism, air embolism, vagal shock, hemorrhage, perforation. Now delayed causes of death. The delayed causes of death is generalized peritonitis. The peritoneal space, there will be inflammation, peritonitis. Septicemia, there will be infection. Toxemia, toxin will be released in the body and lot of toxin would be there, so there will be a toxic shock syndrome. Toxic shock syndrome can also happen. Important IPCs which are related to the abortion. A very important topic right here, sir. Important IPCs which are related to the abortion. So 312, 313, 314. If you see, yes sir, here in 312, 312 is with the consent of mother. 312 is with the consent of mother. 313 is without consent of mother. 314 is death of mother due to abortion. Then the IPC 314 will be there. So with the consent of mother is 312 if we do the abortion. Without consent of mother it is 313. And death happening during the abortion or after the abortion because of abortion, then 314 will be charged, my dear friends. The next beautiful topic what we are going to start right now, sir, that is your surrogacy. Surrogacy is the next beautiful topic we are going to start. So surrogacy is the next beautiful topic what we are going to start, my dear friends. In India, allosteric surrogacy is legal, allowed. That means only medical expenses are paid, nothing else. During the pregnancy, only the medical expenses are paid. Other money is not at all paid. If other money is also charged, then it is illegal, totally banned in India. That will not be legal surrogacy. That is why the term is written right here is altruistic. Altruistic surrogacy means money should not be the primary reason. Now there are the salient features of surrogacy. Bill 16/2020. Bill 16/2020 bill was there. Surrogate mother must be, yes. What are the conditions required to be a surrogate mother? Surrogate mother must be married woman who is a close relative to the intended couple. If some ex-couple want a baby and they are unable to produce the baby, when we consider the female infertile, yes. When we consider the female infertile after couple infertile, couple, after 1 year, after 1 year of unprotected intercourse, after 1 year of, then they are infertile couple. Now they are looking for baby. All the method, all the artificial insemination, all the in vitro fertilization they have tried, but they fail to produce child. Now the last option doctor has suggested for the surrogate mother. So surrogate mother should be their close relative only, who should not do this for the money. Medical expenses you have to pay during the time, 9-month medical expenses you have to pay, dietary expenses you have to pay, but never extra money, any gold, cash, plot, sale, nothing, car, etc., nothing need to be gifted there. Ideally, between 25 to 35 years of age. The ideal age for the surrogate mother is 25 to 35 years, my dear friends. And if we require a donor, sperm donor male, up to 40 years, she should have her own child. Like male donor, surrogate mother should also have her own child first. She should be married, close relative, ideally age should be between 25 to 35 years of age, and she should have her own child. Can only surrogate once in her life. It's not allowed after one surrogacy you are going for another, you are making this as business. No, only one time you are allowed to be a surrogate mother in your whole lifetime legally, my dear friends. Now, intending couple must be, for what is the criteria for the couple now, sir? Intending couple must be both Indian citizens. If it is happening in India, both should be Indian citizen. Married for at least 5 years. Married for at least 5 years of marriage is required, and have proven the case of infertility. That when we consider the couple infertile after 1 year of unprotected intercourse. Violation of any section is punishable with 10 years of imprisonment and 10 lakh fine, my dear friends. If you violate, any violation is there, marriage was only 4 years, the surrogate mother was not relative, the surrogate mother was paid money, my dear friends, there was no case of infertility. If those are the scenarios, then you are violating the rules and you will be punished for 10-year imprisonment and 10 lakh rupees fine is there. So let's revise again the topic called as surrogacy. Surrogacy will be done, is legal only if it is not done for the money. Then surrogate mother must be a close relative, should not take money for the secondary gains. That money should be given for only diet and the medical expenses, my dear friends. Other than that, she should be married, her age should be 25 to 35 years of age, she should have her own child, and she can surrogate only once in our life. That intending couple, the couple who want the surrogacy, they both should be Indian citizens, my dear friends. And plus one more thing you can add here, race also same. Race also should be same. Both Indian citizen, married for at least 5 years, my dear friends, have proven the case of infertility. What is infertility? Having unprotected sexual intercourse for more than 1 year and still no pregnancy is there, then this is a case of infertile couple, my dear friends. And violation of any section is punishable with 10 years of imprisonment, and there would be a 10 lakh fine. Thank you so much, my dear friends.